Well, we're back again. Here we are live at ViVE, vibing at ViVE 2024.
For our on-the-road edition of one of, I think, a couple of the Reverse Mullet Healthcare podcasts.
On the road. I'm
Yes.
Dave Pavlik.
And I'm Ellen Brown. Two of our three co-hosts are here. And we are here with Tressa Springmann and excited to talk to her about change. But first, Tressa, tell us about yourself.
Great. How much time do we have?
See, party. She knows it's party.
She
in the
knows.
front.
Well, we've been lucky to work with Tressa in our past lives too, and so it's nice whenever with people we know.
Oh,
But since you asked about 2 minutes.
2 minutes. I'll be a lot quicker than that. I'm Tressa. There you go. I serve as the Senior Vice President and Chief Information and Digital Officer for LifeBridge Health, which is
Very impressive.
about $2 billion in revenue integrated delivery network in the Maryland area.
Yeah, which is a fun state.
Oh, yeah.
To participate in. And so Tressa, and you are here for multiple reasons on behalf of LifeBridge, obviously, but also your involvement with the event and those that have put it on. And I think you were speaking, or can you tell us about that?
Yeah, sure. I actually am the incoming board chair of CHIME, and CHIME is one of the two participating organizations here at ViVE, along with HLTH. Been in healthcare IT for a long time. Ellen, as you've mentioned, I'm here. I brought a number of my team members here. It's really important that we remain relevant by understanding actually what's going on in the industry, what's real, what's not real, what's trending, and how to make sure we're bringing those best practice insights and innovations back to LifeBridge. And the same is true with my participation with CHIME. It's an opportunity for me to give back to an organization that really paved the way and provided just a tremendous amount of education and professional development for me when I was an early CIO.
What was your topic when you were on the stage?
Well, I'll let you answer it, and then I have to weigh in too.
So you've heard of hiring to your weak side. Well, this was just totally leaning to my weak side, which is anything legislation and policy. So it was, these days there is a tsunami of healthcare IT policy, legislation, state level, federal level. And I'm not good at it and I don't like it. I mean, I actually love reading vendor contracts, but reading the Federal Register is just mind numbing, and then trying to understand it, interpret it, do something about it. So I've got to recognize that is an important part of my role in the organization, to make sure that we're compliant and that we understand what those requirements are going to be, how to resource them, how to appropriately budget for them, and make sure that we're good participants in that space. But CHIME specifically has a policy committee that I've been very actively involved in, because they do a tremendous job not only advocating for us in DC, but also, honestly, in the case of Tressa Springmann, dumbing down these requirements and expectations so that there's something digestible that I can bring back and make actionable and keep us compliant at LifeBridge.
That's great. Yeah, and Tressa and I talked briefly after her speaking engagement. I went and listened, and the first thing she said is, "Are we going to have to talk about policy?" And I said, "No, we will not be talking about policy."
Here we are talking about
policy.
policy.
That's not really the party in the front either.
No.
So I mean, you can't in 10 minutes you can't talk about policy necessarily. Although you could answer when I ask you the question I ask you, you could decide that that's your answer, and then we could talk about it. But I'm going to say that you're bringing that up yourself
policies.
if you do that. Yes, but I will say, when you talk about policy, she was talking about just your virtual clinic at LifeBridge. And I don't want to go down this road unless we do, I hope we can do a full episode in the future. But what really struck me was, we think about virtual health. This just kind of grounds the policy and we'll move on, is hearing you say that a Maryland virtual health provider has to be licensed in every state. That blew my mind.
Well, they have to be licensed wherever the patient that needs care is.
Yeah.
Right.
So in Maryland, if we've got a patient that, I don't know, they have something uber weird and they would really benefit by a specialist, most people in the American public don't understand that if this specialist is in New Mexico and isn't credentialed in Maryland, we're not able to bill for it. We're not able to actually leverage that. each state has their own credentialing process, takes a number of months. And of course, there's a lot of money that gets paid down.
Yeah.
It's so, we talk about workforce shortage. I mean, that's just ridiculous, right?
How do you know where they are?
Well, I heard you didn't say this, but I heard that there's kind of a no, don't ask, don't tell when you're talking to patients. You did not say this.
I might have done that once.
I heard,
on a virtual visit.
Okay, so let's get to the big question here, which is the platform of the podcast, which is, what are your thoughts? And you don't necessarily have to be passionate about it, but what do you think could affect real change in healthcare? All caps, the big, kind of the big conversation that we don't necessarily make time to have or don't have time to have.
Look, I understand why the automation of healthcare occurred in the United States from the health systems out, right? It was much easier to incent them or penalize them, get them to adopt technology, etc. I look forward to a time when that whole ecosystem is disrupted, and instead it's from each of us in.
I know, right?
Where we have our data, we decide with whom we want to share it. It's very easy if you're part of my care circle.
Can I
to
give
help
you knuckles
out
for this?
Oh, So but unfortunately, right, from the inside out, and now looking at how do you bring it back from the outside in, I don't know. I think there's some pretty big barriers to it. Probably the single most barrier, which impedes us a lot in healthcare, is the flow of money, right? And how reimbursement occurs.
Well, and that's a big platform of ours, is payment transformation, and how we, again, though, it's like we're forcing things on people, and but the reality is that we have to change the economics so we can move from sick care to health care. We just do. And like I always say, my utopian moment would be, I always say, if by the time my kids are full grown adults, I'm probably, in like older adults, that it pays to be healthy.
Yeah.
Right?
Yeah.
But I mean, that would be.
They have a vested interest and an excitement and a commitment. And we're seeing a lot more of that now.
They're supported with that.
And the technology's caught up. The generations are catching up. The advocacy for one's health and wellness is starting to grow.
Finally.
I know.
There's like but
now how are we going to make sure the infrastructure allows them to lean in and own what's theirs anyway? Which is all the information about them.
I hope that enough health systems understand that and they're willing to redesign. Because that's what scares me, is that it's just we're gonna require a disruptor to come in and just like implode the system, And then like wearables, these guys make so much fun of me and my wearables. And like the amount of data I have about myself that I can't even give a provider, it blows my mind.
Yeah.
So anyways, okay, well, this is it. It's like I said.
Apparently we have a shared passion there, Alan.
I know. I'm actually like super excited to like talk to you more about this. So, because we all have time for more conversation. Anyways, we appreciate you coming on.
Thank you so much.
Making the time, Tressa.
Appreciate it.
Yeah. Thank you for having me.
All right. Bye.